Hello everyone, this is Chadi Alraies from CVI 2022 in Denver, Colorado. I'm really privileged today to be with Dr. Jeff Chambers, who is the CMO of CSI, but also he's an interventional cardiologist at Metropolitan Heart Institute. Jeff, always nice to see you.
Always good to see you too. Thanks for having me.
Absolutely. You are the most hybrid physician I have ever seen. The most dynamic.
Well, thank you. Thank you.
You are already a pioneer, started teaching us about atherectomy and how to approach severely calcified lesion with Orbit 1 and Orbit 2 trials. And you did today a phenomenal session on atherectomy. So tell us what is up to date about these lesions.
Yeah, I think what we're learning is how to advance the technique. So we know the standard technique, who to use it for, anybody with severe calcium. We're using so much more imaging, so we're seeing so much more calcium. And then, what lesions can we treat?
Yeah.
So I think the real thing that's new is that we have the glide assist feature. So with the glide assist feature, you can actually cross the tortuous lesions, severely calcified, and you can treat retrograde. One of the problems was the device would tend to store up force and jump a little bit, and now that we treat retrograde, we just don't see that.
Exactly.
So tortuosity is really not the problem that it used to be.
Absolutely.
So it's opened up a whole nother group of patients, subset of patients that we can treat effectively.
Absolutely. So how about the implementation of imaging into evaluating these lesions? Is it important?
Yeah, it's really important. So you image, and we're finding particularly nodular calcium. There's not many other devices that can really treat that effectively. So lithotripsy is a good technology, but it tends to bounce off the nodules, and rotablator tends to score up. It doesn't really impact it. Orbital has kind of the dual mechanisms of action where it removes the calcium and actually softens or fractures the calcium, so you really get that maximal stent expansion.
So maximal stent expansion also helped the recoil from happening because you're fracturing the media more than just the intim.
Right, you're doing more of the media, so you get that benefit too. So it's been a great technology. Absolutely. And then CSI just came out with a scoring balloon, Scoreflex, which is a little bit different than the other balloons because there's been a lot out there for a long time. But this is a nylon-based balloon, so it's really strong. It's like the strongest, most non-compliant balloon. So we're really seeing for those kind of moderately severe lesions that you can really fracture that calcium. You've got the two wires on the outside, and it really digs in and fractures it. So it's a kind of another tool for the toolbox. It's more crossable than a lot of the other scoring balloons, so it's been a bonus as well.
We have in our lab also Sapphire 1 and Sapphire 2.
Yes.
And so for these small balloons, when you have that tortuous and heavily calcified lesion.
Yeah, fantastic.
Yeah.
I mean, nothing else crosses.
Yeah,
right?
the nose cone is really sharp, but it's also pliable.
Yeah, we're really mobile. Yeah. So fantastic.
In terms of complication rate, as well as people sometimes worry about particle distal to CSI. Is it something still worrisome anymore, or?
Yeah, so we really, so in the coronary space particularly, we haven't seen that. So our slow flow, no reflow rate, in the Orbit 2 trial, and that's when we were all first learning to use it together, it was like 0.9. And then if you look at, once we learned better techniques, shorter runs, rest between runs, give calcium channel blockers, nitrates, adenosine, whatever you want to dilate the microvasculature, the rate is like 0.7, so it's really low. And so it's a good good device for that.
Yeah, in our lab, I mean, with a Vibraglide as well as with the good anticoagulation, almost zero. Whenever I had that.
Yeah, I'm not going plastic here, but I really haven't had a problem with that. I really haven't seen it. So it's been
Jeff, thanks so much for your insight.
Well, thank you.
Thanks for all that.
Always a pleasure.
Absolutely. Thank you. Please watch this video and others on the CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Thanks, Jeff.